Yeah, so November of 2018, I became very aware of a problem with my left shoulder. I'd been dealing with pain for a good part of a decade, really just pushing through it. Never had a major injury in my life, so didn't think much of it until the day I was on a bench doing dumbbell bench presses, and my arm gave out, so I knew that there was actually something fairly wrong going on. Through that process, they started with x-rays to look at my acromion to see, what the curvature looked like, make sure there's no impingement there, no issue there. They then proceeded to tell me that in order to check off the boxes with insurance, I had to get a cortisone injection, so I did that. Found no relief, so obviously it wasn't an inflammatory issue. At that point, they then ordered up the MRI, and that revealed all things. They found a near full thickness tear of my supraspinatus tendon. I went through physical therapy for a good 3-4 months post-surgery. Went through, all the checks, balances with that. Never really got full range of motion back, which I was told that I never would. Strength was an issue. I've been laid up for almost a year now without doing any real pressing motions, lifting weights. The whole process, I've lost about 15 pounds of muscle over the course of that year, so I was really wanting to get back to my normal routine of lifting and lifting heavy again. So I thought I'd reach out and see if anything could be done. The ultrasound was interesting. So there were a couple occasions through the recovery process where I kind of moved in ways I probably shouldn't have too early. So I'd always wondered how well the surgery took, right? I mean, we're talking about drilling a couple screws into your humerus and tying it down with a couple strings, and I always questioned that, right? So through the ultrasound, it was kind of interesting to be able to see inside of there and see that everything kind of looked intact, see the scar tissue, even interesting enough to see the threads of the screws and the anchors that they put in. So that was a really neat thing, and it kind of gave me a lot more confidence knowing that, yeah, it wasn't pulled off the bone, it was actually intact, and that kind of, again, gave me some confidence moving forward. The treatment was interesting. No pain in the treatment. Just some manipulations of the glenohumeral shoulder capsule, and found instant dramatic changes right after that, 10-15 minutes at most. Range of motion improved dramatically, and pain levels have actually gone down, specifically when I sleep. It disrupts my sleep a lot. I'm a side kind of stomach sleeper, one arm overhand or overhead. So I've never been able to lay on that side, which I still don't. But the pressure of that shoulder, depending on the position I'm in, would cause some discomfort. And now I actually only wake up maybe once a night instead of 4 or 5 times a night.
Oh, wow.
So I've seen a lot of improvement in my sleep pattern.